and welcome to the Caring for the Care Partner session. My name is Dr. Liana Rosenthal, and I'm the director of the Ataxia Clinic and the Ataxia Center at Johns Hopkins. For the next 45 minutes or so, we are going to be focusing on the care partner and what we can do to care for that care partner. So first, I want to give some definitions for you. In terms of care partner burden, and that's really what we're also talking about here, care partner burden is the strain or load borne by a person who cares for a chronically ill, disabled, or elderly family member. And when we talk about care partner and care partner burden, it includes the personal feelings of the carer, so the care partner, while performing caring functions. And then it also includes events related to negative caring experiences. And that's where the burden part comes in. There are, of course, also positive experiences that come from being a care partner as well. But we're really focusing here on the care partner burden aspect of things. It refers to the psychological pain, the physical health issues, the financial and social strains, the impaired family relationships, a sense of hopelessness, and other negative outcomes of care tasks. And that's really, again, the burden. But I don't want anyone here to leave the session today thinking it's all negative. But I think it's important when we think about caring for the care partner that we really acknowledge this burden and the burnout that can come from that. So a few demographics. In 2009, about 65.7 million individuals in the US served as unpaid family care partners. It is mostly women, on average spending about 20 hours per week providing care, but with 20% of people spending more than 40 hours per week providing care. It includes care for sort of both basic and instrumental activities of daily living. So this would be things like helping brushing teeth, helping toileting, helping get dressed, helping cut food, helping with bills, things like that. And then also medical support. So giving medications, scheduling doctor's appointments. And of course, the care partner also provides emotional support and comfort. Oftentimes, care partners, they're members of your family. And so there is an emotional support and there is a relationship that predated this care partner time. And now it's important to recognize that spousal care partners have specific challenges related to being care partners. And this isn't to minimize the burden of being a parent care partner or being an adult child care partner for your parents, but rather to recognize that spousal care partners do have some additional challenges. Spousal care partners are more likely to live with the care recipient. So in other words, there's never a time when the spousal care partner isn't part of the caring. They have little choice often in taking on the role. And when looking into being a care partner and what it means, one of the big predictors of burden is this element of choice. This idea of, am I able to choose what I do? Do I still have some autonomy and some self-control? In addition, spousal care partners are also less aware of the toll it is taking on them. And I see this a lot because we all, in some ways, care for our spouses. And we've cared for our spouses before they got sick from whatever illness. And so we're not always aware of all the various ways that we're sort of picking up on things that our spouse used to do. And in addition, spousal care partners are oftentimes more vulnerable because of age and other medical conditions. So especially when the individual being cared for is older, chances are their spouses too, so may have their own health conditions as well. And there are a number of things that increase this likelihood of developing care partner burden. So a lower education level, which I suspect is linked very much with financial stress, because certainly if there isn't any give on the finances, it's really hard to do this. It also means that you can't hire help to help you along the way. Living with the care recipient, so that again goes back to the spousal care partners. Depression amongst the care partner that is separate from their role as care partner, that can also contribute to burden. a higher number of hours spent caregiving, which also means that there is less autonomy and less say over what they do with their time, lack of choice in being a care partner, and then the social isolation. And I want to highlight social isolation in particular, because I really think that during COVID in particular, the social isolation of being a care partner skyrocketed. So in order to keep the person that you're trying to help safe, you may not feel comfortable going out with friends. You may not feel comfortable meeting up at the mall. You may not feel comfortable having lunch with any of your friends. And so that social isolation really grew for a lot of us during the COVID pandemic. But then especially with being a care partner, it makes it even more difficult. My neighbor down the street is a care partner for her spouse, and she'll often talk about the social isolation and how it really is a lonely and individual job being a care partner. But that being said, there are things that we can do, and there are things that you can do to try to reduce the care partner burden with the hopes of being able to maintain that relationship that is making you a care partner in the first place. So you love your spouse, we presume, and the idea is that you're caring for this person because you want them to have better quality of life. So how can you set it up to still reduce the burden, but still feel good about what you're doing and why you're doing it, and maintain that relationship that you have with the person you're caring for? You know, you're their spouse, you're not just their care partner, you're their child, you're their parent. And that means more than just being their care partner. So here are some things that you can do to try to reduce the care partner burden. You can partner with the doctor to function as a member of the care team. And so it's important that your needs be articulated during a doctor's visit, because there might be something that can be done to help. So for example, I have a number of patients who get up to use the bathroom multiple times overnight. And this is a little bit of a problem for the patient because it means they're not sleeping as much, but it is sometimes a huge problem for the care partner because it means every time the patient's getting up, the care partner has to get up, which means they're not getting that much sleep either. And so sometimes the need to address a symptom is driven by the fact that the care partner isn't going to be able to get up 5 times overnight and still function during the day. So that's a really important point, that your needs need to be articulated during the doctor's visit. It's also important to improve your self-care and maintain your health. And there's a lot of time that we talk in the popular press about self-care, and that means different things for different people. But I think certainly exercise is important for the care partner. Seeing your friends is important for the care partner. Having and keeping some of your life that you had before you were a care partner, maintaining a little bit of who you are above and beyond being care partner. And so improving that self-care and maintaining your own health. It also means going to your own doctor's visits and taking care of your own health maintenance needs. It's also good to educate yourself about the illness. So with that in mind, some of the symptoms that the person you're caring for are having, how much of this is the illness and how much of this is their choice? How much of this is them being willful and how much of this is the illness? And understanding the illness, its implications, and its symptoms can also really help to at least make you understand what's happening to this person that you love. It's also good to use technological support. So if you need a lift, use a lift. There's also actual technology. So in terms of communication, you can have different technologies that can help with that. There's different silverware that people can use to sometimes help them be able to feed themselves. So that way you don't always have to feed someone. There is different, there's like a rocker knife that people can use to cut their own food. That's a little bit easier. So there's things like that that you can do really to both decrease the amount of work you have to do as a care partner, but also give the person you're caring for more independence. And so both of those things are important. It is also really important to coordinate and obtain assistance with care. And it's not that the care partner can't do everything. They can cook food and clean up the kitchen and help get their person dressed and all of that. They can do each individual thing, and you can do each individual thing. But I find that when people try to put it all together, it's impossible to do it all. There's just not enough hours in the day. And that is where obtaining assistance with care. And sometimes this means paying if there is financial resources to pay. Sometimes this means getting help from other family members. So there may be, if you're caring for your spouse, there may be adult children that can help, every Monday afternoon or every Saturday afternoon. And that way you have a little free time to be able to do what you can. And you can also ask around. There may be some people in your neighborhood or in your community that are willing to come and help out, whether for free or paid, that you can get some help around the house, even if it's help cleaning or cooking or things like that. So that way you have a little bit less to do with your time. And the goal in some of this is so you can also both enjoy time separate from the person you are caring for, but also hopefully enjoy time with them too. So that way you're not always in that care partner role. Instead, you're their spouse, or instead you're their parent, or instead you're their child. And it's not always about you providing care. You can do what you can to try to maintain that relationship. And then finally, the other thing that's really important is to access and use respite care. And so respite care may be for you lunch with your friends every Tuesday. It may be for you the chance to go away for a weekend. I had a patient who, even though she has no intention of going away for a weekend, because she really has nowhere she wants to go, this idea that she can use respite care has been so freeing to her that it's something she can do. She can get away if she wants to, even though once she realizes she can get away, she really doesn't want to go anywhere. But it's just this idea that she can go somewhere. So these are some of the things that we've talked about in terms of reducing care partner burden. And then we also already spoke about some of the challenges of being a care partner and some of the difficulties that can be encountered. And I really worry sometimes about the health and well-being of the care partner, because it both relates to their health and it also relates to their ability to provide care for the people who are my patients. So I look forward to hearing from everyone else, and then certainly looking forward to the question and answer as well, where we can talk more about ways of reducing care partner burden, and also talk more about the way that being a care partner can both negatively and positively influence your health and your quality of life. Thank you so much.
Hello, my name is Frank Tinari, and I'm the husband and the one responsible for the care of my wife, Barbara. Right after our 46th wedding anniversary, she was diagnosed, she was 68 years of age, she was diagnosed with cerebellar ataxia in 2014, which was refined a year later to cerebellar multiple system atrophy, MSA. I had just retired from active employment about the same time, so I was able to devote quite a bit of my time to care for her here in New Jersey. My caregiving history can conveniently be divided into two phases. The first phase started around the year 2015 and continued through March of 2020. Then the second phase began, which I will talk about in a moment. First, let me say, had I been working at my full-time job over the past several years, it would have been very difficult to provide the care that I did for Barbara during the first phase. 2 of our 3 daughters were living out of state, and our other daughter, who lived nearby, was raising her own family and teaching full-time. All of this speaks to the necessity of having a good support network, whether through spouses, family, neighbors, or friends. If not, as some of you probably have learned, it is not easy to find an aide or aides with a good fit for your needs, and the expenses can be high as well. Ataxia has a steady and sometimes slow progression, so caregiving needs to change over time. Early on, Barbara would need help getting into the car and climbing stairs. So we eventually had a stair lift chair installed at home. A bit later, she began using a walker regularly to get around. And then we began using a wheelchair, for example, when we went to our fitness center or to a doctor's office. After several years, when we were ready to buy a new car, we purchased an SUV for the first time because the passenger seat was higher, which made it easier for Barbara to get in and out of the car. I think you would agree that it's never easy to change our living habits and routines, but family caregivers should expect to do so. Happily, in my case, the changes came slowly enough for me to adapt gradually to new and different ways of doing things. To keep from getting frazzled while caring for Barbara, I tried to do two things. First, keep up with some of my hobbies and daily activities as much as possible. And secondly, to do things together with her. The most important was to spend time in activities together. So we began going to the fitness center and using the pool about 4 mornings a week. She was doing water exercises while I swam alongside. We also began playing more cards and other games together, sometimes with family members. And we also began to watch more movies together at night. In addition, since I had never cooked meals, Barbara would sit in the kitchen and direct and instruct me to prepare various dishes. It was a team effort, sometimes more successful than others. Another activity we did together was to attend ataxia support group and MSA support group meetings together. Now, phase 2 began around March 2020, the time that COVID shutdowns hit all of us. One of our daughters moved back close to home to begin helping Barbara, and a few months later, our other daughter did the same. So I then had lots of support from them. They were really taking the place of home aides. The following spring, Barbara and I signed up for a Zoom program called Broadway for Ataxia, where we do acting and singing each once a week with a trained actress singer. In the past few months, Barbara has needed more help getting dressed, eating, and even changing her position in bed. So with the help of our daughters, 2 independent aides were found and hired to stay with Barbara overnight. There is also daytime coverage by our 3 daughters in a schedule that they make. Barbara and I have always been faithful churchgoers, but she now finds it difficult to get out. So I attend Mass on Sunday and bring back the parish bulletin and the Holy Eucharist for her. We pray and sing a little together before she receives communion. A takeaway from my experience so far is that every caregiver needs support, either from family or friends. This allows the care partner to continue to do some things for themselves. Secondly, caregivers need to focus on doing things together with their loved ones, as we have tried to do. And I hope many of you can do the same. Thank you.
Hello, everyone. My name is Stephanie Leonard, and I'm a mother of twin boys with spinocerebellar ataxia who were diagnosed around the age of 3, and they are now currently almost 10. The one emotion that stands out the most to me, looking back to the official diagnosis day, was the feeling of uncertainty, the feeling of where do I begin now? Where do I start? And that is a really scary feeling. You know, we have this designed outline for our children that we as parents make. And whenever you receive news this way, it almost jolts you. It's shattering. You quickly realize that your outlined future for your child has been altered. And not having a good support group or a good team of support can be detrimental in a time like this. My husband and I quickly discovered that it was crucial for us to build our team of support to help get us through this new journey that we were facing. We started with building an amazing team of doctors and, doctors that would understand our boys' needs and adapt with us as they grow. And also just our friends and family, opening up to them and sharing with them what emotionally we're going through and what troubles we may face on a day-to-day basis living with children with ataxia. Allowed them to understand a bit more and offer help in ways that we actually needed. So allow them to help you. And also within the school district, it is incredibly important as a parent to be that advocate for your child, to speak up for them, for their needs, because as an outsider, we see what may be a little bit more helpful than what your child may see. So reaching out to the schools and allowing them to understand and adapt throughout the years to come is incredibly important. For example, talking about the schools, how incredible ours have been so far. Whenever COVID hit and our boys had to resource to online learning, we had some incredible challenges that we faced. Our boys at the time were in 3rd grade and they were still struggling to read independently. And whenever you're now giving a child a computer at home and asking them to read their assignments and be responsible with those assignments, it could be really emotionally overwhelming for everyone. And having a support group within the school, they're really good at being patient and offering extra help on the side and adapting to those needs. Our boys were unable to read their assignments, and so they weren't really sure what to do. And true story, actually received an email from one of their teachers saying that they were missing 28 assignments, and they swore they turned them in, but they weren't aware that whatever they were doing was not actually completing the assignments. They just kept clicking the submit button. So having a team in the school zone or in the school district who is there to help you with those needs is incredibly important. They had adapted in a way of allowing the boys to simply just click a button, and it offered the service of reading their assignment to them. So they were better understanding of what was expected. And then, they didn't know how to type. So they quickly adapted to those needs by offering a click of a button where they could just speak in a microphone and their answers were typed out for them. So that was a bit of a curveball. Now, the emotional impact that COVID had on our family, I believe most was, I think as parents, it is really important to get through this new journey and phase in life that we are now faced with every day, is to just focus on all the small moments of accomplishments and celebrate those as big wins. I know it's easy to get caught up in the comparisons of your child versus another, whether if it's versus another with ataxia or another who does not have a rare genetic disease. It's easy to get caught in the comparison. And I think my family, we've done well with, and it's helped us get through this season of life by just focusing in on what they are achieving and accomplishing every day, and celebrating that, and not letting the comparisons rob us from the joy that is present. However, COVID, whenever our boys were online learning, I remember just melting down as a parent because I heard these little 3rd graders responding to their teachers like they were little adults. They could read and they were speaking and answering questions and just on top of it. And then there were my boys, and it required a bit more patience from the class and from the teacher. And that's something I didn't get to witness every day when they go to school because I don't go to school with them. But overhearing it with online learning, it was a bit of a heartbreak for me. But that's where the team of support comes in. The team of support quickly redirected me from, not spiraling down into that emotional breakdown phase of grief. And it helped me realize that, it's okay. My boys have come a very long way and they're doing an amazing job, and I need to focus in on that. With that said, I feel like the most important part of this team of support is with the National Ataxia Foundation. Whenever we first found out about the boy's diagnosis, it was within the same month that I stumbled upon this amazing community of people, and we quickly hopped on a plane and attended the conference. And it was exactly what I needed. I needed that community of people to learn from and to receive direction from. It was comforting to know that there were doctors there ready and willing to learn more and educate themselves more on this rare disease. And it just provided so much service. And lastly, the National Ataxia Foundation has extended that network, that community, with now I'm an admin of this one page on Facebook. It's a group called Parents of Kids with Ataxia, and it has offered an amazing platform for us parents to just gather together, whether you're on your official diagnosis day and not sure where to turn or what to do next. You can ask those questions there. Or if you are further into the journey of this ataxia world and you just need a sounding board to grieve, you have parents there who are willing to lift you up and keep you strong. So if you are a parent of children with ataxia and you have not heard of that page, I encourage you to check it out and give it a chance to just let us join hands, link arms, and get through this together. I am so grateful to be here today, and I appreciate this foundation and everything that they're doing for our babies. Thank you.
Hi, I'm Sherri Hubbard, SCA 7 Care Partner. I've been asked to share some helpful tips that have benefited me over the years as a care partner to my husband, children, and mother-in-law. My tips are: number 1, be a healthcare advocate. When navigating the healthcare system for your loved one, you will have to be the advocate on their care team. While doctors, nurses, and various medical professionals are the experts in their fields, remember, you are the expert when it comes to knowing your loved one. If a plan of care doesn't seem to be working, go with your gut and the knowledge of your loved one. Speak up and make a case for why it should be changed, tweaked, or abandoned. Most doctors will respect and understand you know your loved one better than they and will listen to your concerns. Also, as your loved one's advocate, make sure you have the proper legal documents necessary to make decisions on their behalf. Don't wait until it's too late when your loved one may be incapacitated. Have those tough conversations and understand your loved one's wishes while everyone is of sound mind and health to execute proper documentation according to your state's requirements. Durable and healthcare medical power of attorney, living well and do not resuscitate, and the like should be considered. Number 2, be an education advocate. When children are involved, you may need to be your child's advocate in the school system. Find out what kind of resources are available to your special needs child and make sure his or her individual education plan addresses all your child's educational needs. That includes adjustments being made for timed tests, whether or not your child will have a helper in the classroom or special equipment being used. Explore all that can be provided to help in the education process. Number 3, in-home care. If you decide on an in-home caregiver, do what you can to avoid going through lots of caregivers. When hiring an independent caregiver, make sure you know what the job entails. Create a job description so the caregiver knows what's expected. Make a list of interview questions to help gauge the compatibility of the person. If you're hiring through an agency, remember you don't have to accept the first person they send. You have input in the matter. Again, the key to minimizing turnover is letting the agency know what kind of person you're seeking as far as personality, work ethic, and if they're physically capable of performing the job. Once you find a good match, remember to welcome him or her into your home as if they're part of the family in order to develop a good relationship, trust, and security. Hopefully, the caregiver will be with you as long as they're needed. Number 4, professional counseling is key. One of the keys to me staying balanced is professional counseling. I do not shy away from counseling. It has been my glue. I have participated in marriage counseling, grief counseling, and individual counseling. This has been very beneficial. Counseling is helpful when you just need to discuss or work through some things with a neutral party. The bonus is when the neutral party is trained to give you sound advice or guidance to help you through whatever has you stuck. There's a difference between a professional and a friend or family member who may say whatever to make you feel better, which may not be the best thing for you in the long run. So my advice would be to seek professional counseling in addition to accepting emotional support from family and friends. My husband and I sought grief counseling after the passing of each of our kids from an organization called Compassionate Friends. They have support groups all over the US. Most hospice organizations offer counseling as part of their program. For a list of various types of professional counselors, check the National Board of Certified Counselors for someone in your area. And finally, number 5, care partner versus spouse. Caring for a spouse or significant other with ataxia can be challenging. But like most things in life, you can't truly appreciate the sun if you don't have the rain, or in this case of ataxia, a torrential downpour. It's all about perspective. That's another reason I seek counseling, because when things get really dark, I need a different perspective to see if I'm missing something. It's important to remember things won't always be this way, and unfortunately with ataxia, we know it gets worse. So living with the knowledge that each day is as good as it gets motivates me to live in the moment as much as possible. I try to find joy in something each day. I call these small victories. When I switch hats from care partner to spouse, Jason and I still enjoy going to the movies, traveling, reading, playing board games, and getting together with friends. It takes a little creativity, more time and patience, and time and patience. Thanks for the privilege of your time. I hope I have shared at least one thing that proves to be beneficial.
Welcome everyone to the live Q&A portion of the Care for the Care Partners session. Thank you so much to our speakers for sharing such helpful information. And we'll just give Stephanie and Frank just a moment to unmute themselves and pop in here with their cameras. Looks like Stephanie's on the move.
I am.
Welcome, Stephanie.
Thank you. Thank you.
Welcome, Frank.
Hi.
Welcome, Dr. Rosenthal.
Hello.
Hello. So I'll start with you, Dr. Rosenthal, and truly appreciate all of the patient care that you provide at the Ataxia Center there at Johns Hopkins. Would like to ask if you would be able to suggest or recommend any organizations or support groups for caregivers.
Sure, absolutely. There's a couple out there. First, there's certainly the Compassionate Friends that was mentioned there at the end in terms of grief counseling. And then also there is something called the Caregiver Action Network. That's another resource that is out there. And then finally, there are these support groups that are run. I know there's at least one support group for care partners run by by Hopkins, but then there's also a care partner support group run through the National Ataxia Foundation. And of course, the parent support group as well, that Stephanie spoke of, also run through NIF. And so I really think that those are really, really useful and really important resources for people who are going through this process. And really just listening to all of the other speakers talk, I'm always amazed by your strength and all the things that you teach me in terms of how you go about your daily lives. I'm just so impressed with all of you. So thank you.
Thank you, Dr. Rosenthal. And I would certainly echo that. Stephanie and Frank, your dedication as loving caregivers is so inspiring. So thank you for sharing your stories with us. And as Dr. Rosenthal mentioned, and as you mentioned in your talk, Stephanie, you lead the parents of children with ataxia support group. And tell us a little bit about that group. I popped the link in the chat for any parents out there interested.
Okay, perfect. Thank you. I appreciate that. So this is a platform that is designed for us parents to really just have a sounding board for one another. We can, ask those questions when we feel lost and we don't really know who to turn to, and not feel like we are going to be bothersome to, others. This is a place where we can actually get direction of someone who's actually been through this process of caring for a child with ataxia. There's so many questions that you get as a parent along the way through this journey. There's just so many unknowns that you can really feel lost. And I feel like this group has really been beneficial emotionally and even just, I don't know, I feel like this is a place where we can ask for medical advice or how to find someone who can help direct us into the right direction for our children, and save us time without having to go through the looping phase of everything and feel like you're back at square one. So it's been a great group so far. So.
Well, thank you for leading that service, Stephanie. And I know, Frank, you're involved in support groups too. Can you tell us how that helps you?
Well, the support groups are very good because there's lots of sharing of information, little tidbits that help that you may not be aware of. Certain new equipment, a new trial, or a doctor's advice or medications. You just really learn a lot. And you also learn how people are dealing with their own conditions in their own environment. So having the support group means that there are other people out there you can rely upon, that you can share things with. And so we really enjoy, last few years on Zoom, but before that in person. And we've also started with the MSA group, also located in New Jersey. And again, having guest speakers, nurse practitioners, social workers as guests really is very helpful. So we endorse people joining up and finding good support groups.
That's great advice, Frank. Thank you. Looks like we have a question here in the chat from Ashley. She's wondering if there's any resources for free respite care. She's gone through the Alabama aging, and she does live in Alabama, but her mom makes too much money, even though she only gets SSI and a pension. So it's not a ton. And then the other agency, she said she needed a dementia diagnosis. So there's not a lot of resources for free respite for ataxia diagnosis.
Mm-hmm.
Any advice or suggestions there, Dr. Rosenthal?
Yeah, I'm nodding because I have found the same problem, that there really aren't very many good options sort of in that in between. And my main advice is for people to try the Office of Aging. That tends to be my main advice as well. But I clearly, Ms. Davis has tried that route and it hasn't been successful. That being said, what I would think about is a couple things. What in terms of, first, obviously family, are there any family that can offer, and family may not be able to offer exactly what you're looking for in terms of like a week away or something, but certainly family can offer, an hour here, 2 hours there, that kind of thing. I would also look at and think about what your needs actually are for your loved one. Do you need someone just to make meals for them? Do you need someone to help with transferring to the bathroom? Do you need someone to help with showering? Like, what are your needs actually? And would it suffice and could it work to get sort of an educated, helpful adult? So do you need a caregiver, like a paid caregiver, or can you kind of get away with for at least a little while, while you're having trying to get a few other things in place, someone else? So, reaching out to, if you are a member of any kind of group, whether it be a religious group, whether it be a social group, anything like that, reaching out through your friend network, through your Facebook network, finding someone who is a friend of a friend who goes to church with your neighbor. I mean, even, those kind of things. Someone who's looking for a little extra cash that can come in even for 4 or 5 hours here or there. It's not, I respect that. I suspect you're looking for a longer chunk of time, but certainly don't let the fact that that isn't working for you and the Office of Aging can't help you take away from finding respite in others, perhaps smaller or different ways. So I would keep that part in mind. But yeah, the system, what I have generally found is that the system is really not set up well for folks that don't have significant resources. And that's awful and terrible. And I wish we could do more with that in mind. But I think those have been what I have found. But certainly I defer to Stephanie or Frank if you guys have had any better luck amongst your groups to finding better ways of doing this. Please take it away.
Yeah, I'd say we first tried some agencies and they weren't quite the right fit. But of course, those, as has been mentioned, are pricey. The actual caregiver doesn't make that much money. It's the agency that collects most of it or a good chunk of it. So my daughters found care.com, which people list that they're looking to help somebody for such and such a pay in the local area. And they are, they may not be trained nurses' aides, but they've had some experience. You can ask for resumes, have an interview. And we found some good people to stay overnight with Barbara through care.com. And it's not, you don't pay a fee like an agency fee. It's a lower cost, but of course it's not free.
Those are great suggestions. Thank you guys for your response to Ashley's question on that topic. I have a question that came in for Stephanie. Stephanie, this question is, what help do you provide for your boys?
What help do I provide for my boys? Oh gosh, let's see. Honestly, we don't have a need to, hire any extra care or help at this time. That's something that I feel like being a part of these groups is educational currently. So in the future, when we do need to access those needs, we have better direction of where to go and how to find it. But as far as the help goes on a day-to-day basis from others, I definitely, have to rely on the extra care that the schools provide, adaptive PE needs, a para to help them finish their assignments. We have to line those up. Us as parents have to be those advocates for our children and be the voice to request those extra needs for them so they can, get the best out of their education and out of their day at school. Outside of school, at home, I do have to, sometimes I feel like as parents, we feel like we can do everything, or we feel like it's our responsibility to do everything. And we can't physically, emotionally, we just can't. So allowing my family members to give us parents that little bit of a break is a way that I feel is helpful for me and for our children. The boys sometimes need help with going up and down the stairs. We help them with that. We do sometimes have to aid them in their toiletry, issues. But as far as helping our kids, it's an ongoing thing, and it's constantly changing, and their needs are changing. And so as parents, we just continue to adapt to those needs.
Well, that's great. And I believe that we're at the top of the hour, which is right at the end time for this session. And we have completed all the questions in the chat. So I believe we can wrap things up for the Care Partners session. Thank you guys again for offering so many helpful tips and suggestions. As Stephanie said, advocacy is certainly an important part of the role of being a care partner. So thank you all for the advocacy that you do for your loved ones out there for ataxia. I truly appreciate it. Any final thoughts from our panelists? All right. Enjoy the rest of your day at the conference, everyone. Thank you.
Thank you, everyone. It's been great learning from all of you.
Thank you, Doc.
Thank you.